So this is a lumbar vertebrae. And that's probably good. I think we can see it. So remember, it's made up of two parts. Vertebral body up here in the front side. Right? And then there's an arch of bone called the vertebral arch. I can kind of hold it like that for you. In this view, we can see some stuff. We have the strongest part of the bone is this region right here, the pedicle. This is the other pedicle on the other side. This is the superior articular process. Superior articular process. Now, if I drop it down like this, because you guys always mess this up on the test, so let's see if we can you see that? It's really smooth right here. They're super smooth. It's a round, it's a facet, right? It's a round facet-like surface. Let me see if I can blow it up for you. Oops, let's get it in there. There we go. All right, see how round that is? That's part of your facet joint or your zygapophyseal joint, aka Z joint. In school, you'll call them Z joints. But in the real world, they're always called facet joints. Just can't, they're officially called zygapophyseal. That's half of the zygapophyseal joint right there. So if number 1 shows up on that little region, you're going to say facet of the superior articular process. If I turn it around like this, okay, see that? We're on the opposite side. We can't see the facet anymore, but that's, so if number 2 is sitting right on that, that's the superior articular process, right? Superior articular process. If I spin it around to the back, there's the smooth surface. So that's the facet of the superior articular process. Everybody got it? And what else can we see here? Transverse process. It's like a little airplane wing sticking out here. Transverse process. How about this piece right here? This is all lamina, right? Lamina connects the spinous process to the articular pillar. Okay, there's the other facet on the other, or the other lamina, right there. What if I put, I forget what number on, number 4 or whatever number 3, right here? What would that be? Well, there's nothing shiny there. It's just bone. So that's the inferior articular process. Inferior articular process. If I flipped it over, so now we're looking at it upside down. Let's see. Look, there's another one of those things. See that little round circle? So that's the facet of the inferior articular process. Facet of the inferior articular process. Okay. Pretty straightforward stuff, I think. Maybe I better back out just a hair. What else can we see on this thing? Now, not all vertebrae have this, but there's a big bump right here. See that? There's another one here. Those are the mammillary processes. Mammillary processes. Multifidi connects into that, and it's some other stuff connects in there we won't worry about now. But that's kind of a side view. Try to blow it up a little. There you can see it really nice. See it sticking out? So the mammillary process, where does it arise from? That's the transverse process, by the way. Kind of deeper into the plane of the page or the screen you're looking at. Well, it comes off the posterior superior portion of the superior articular process. Because, right, this is all superior articular process. Right, and there it is sticking right off the back. Sometimes they're easy to see. You're supposed to learn to palpate these. You'll learn that next quarter. I think they're really pretty hard to palpate. Some of them aren't that prominent. Let's see if I have a better one. I want to show you the articular process. These are pretty hard to see. Let's see if we can see it. Yep, there you can see it. See the little bump right there? There's the mamillary process. And that little bump right off the root of the transverse process, posterior inferior aspect of the transverse process, that is the accessory process which some of those little muscles connect to as well. That's the transverse process sticking out there. Kind of give you back out so you can see where I'm at. Got it? I need a helper to run this camera. That looks blurry. All right, so let's see. I think that's all the main stuff. Then, of course, the spinous process. That basically grows off when the two lamina fuse together in the midline, the spinous process grows off the back of that. And we said the vertebral. Let's turn it around. Look at the vertebral body. There's the vertebral body. There's, see the ridge of bone here? That's the ring apophysis, or the rim apophysis, or the ring apophysis. That's the growth center where the bone grows, gets its vertical height from that. And let's see which one of these has the best vertebral notch to look at. I guess this one's a pretty good one for everything. So let's take a look at this from the side now. Right, here's a side view. Superior articular process right there. Inferior articular process, including the facet of the inferior articular process. But then you will see we have a notch. So that's called, because it's, here's the pedicle, because it's off the inferior portion of the pedicle, that's the inferior vertebral notch. The inferior vertebral notch. Superior vertebral notch, you can see it, but it's really little. That's that little notch right there. That's it. That's the superior vertebral notch. And again, I said this in lecture, the confusing thing about this is the inferior vertebral notch makes up the superior portion of the vertebral foramen. All right, let's see if these two fit. Let me show you what I mean. Okay, now I'm going to run out of hands. Let's see how I have two bones together now. And you can see I'm out of hands. I can't point. But you can see the inferior vertebral notch would be right here. I guess I can kind of point. But that makes up the inferior vertebral notch up here makes up the superior portion of the intervertebral foramen, which is that hole you're looking at. Normally there would be a disc, so it should look about this big. All right, so that's the IVF. Those are the notches. And I think that's about it for the lumbar vertebrae. Not too horribly complicated. Anybody, I can see the chat, so anybody have any questions about that? We're ready to move on to the next thing. Kind of a big lab today. Nope, don't see anything. All right, let's go talk about ligaments now. We're going to have to use pictures again. All right, so I'll go over these in class too in about an hour at 1 o'clock, so I can do that again. But just real quickly, here is the bone. This is an A to P view, so we're looking like this. Right, kind of a head-on view. And from this view, we can see a couple ligaments. We see the anterior longitudinal ligament here. Let's see if I can maybe, let's blow that up a little bit more. Okay, anterior longitudinal ligament. Now here, we've cut the vertebral body away from this. In fact, this is one of your lab questions today. What is this stump right there? Those are actually the pedicles. We've cut the pedicles right off. So the vertebral body is removed, and we can see the roof of the vertebral canal here, or the vertebral arch, or call it the neural arch if you want. So this is ligamentum flavum. We've talked about it a little bit, but it's very clinically important. This is the one that you're going to treat patients where this thing is really, really thick and has caused what's called central stenosis. So that's clinically important. It's usually a little more yellow color than that. You can also see a little stub right there. That's the posterior longitudinal ligament. So the posterior longitudinal ligament, at least the main part of it, is pretty skinny in the lumbar spine, but it has an accessory portion to it we'll look at in class. Notice the anterior longitudinal ligament is much wider than the posterior longitudinal ligament, which is right behind this vertebrae. Right? And then there's the little ligament that runs between the transverse processes here. Take a wild guess what that's called. How about the intertransverse ligament? Right, so that's pretty simple. Let's go look at this picture now. This is exactly on your lab worksheet. So, let's see. I think I put this as L1 on the worksheet. So we have an intervertebral disc between the two adjacent bones. Remember, what's the motion segment? Does anybody remember what the motion segment is? The functional unit of the spine? That's a vertebrae disc vertebrae sandwich. So that we're looking at a motion segment right here. All right, and that's the intervertebral disc, a little cartilaginous pad that sits between them. It has a nucleus pulses on the inside, and it's corralled by a much stronger ligamentous structure called the annulus fibrosus. Annulus fibrosus, nucleus pulses. Probably blow that up even more. If I can figure out. There we go. All right, nucleus pulses, about 80% water. These little rings, I don't know if you can see that clear, but those are called the lamellae, and we'll look at those more in class, probably tomorrow. There's also another pad of cartilage. See that dark, kind of a purplish color? Those are the cartilaginous vertebral end plates. Cartilaginous vertebral end plates. And the bone above this bone right here, that's called the bony vertebral end plate. Bony vertebral end plate. Most people, when you're just quickly talking about, they'll just say vertebral end plate, and it's kind of understood if you say vertebral end plate, you're really just talking about this bony part here. But technically, this is bone and this is ligamentous structure here. Okay, so you should really technically say, if you want to talk about the cartilaginous end plate, then call it that. And call that the bony and not the cartilaginous or the ligamentous. What else? We can also see, let me move this forward. There's a nice view of the intervertebral frame in here. You can also see ligamentum flavum. We'll talk about that one, how it holds the back of the vertebrae together. You can also see, oh look, there's one of those circle things. That's the facet of the superior-articular process of L1. Okay, now let's move down a little bit. So we can see spinous process here, another one down here, and there's a ligament that runs between the spinous processes. And take a wild guess what that's called. How about the interspinous process ligament? Interspinous process ligament. There's also another one that runs on the top, the tips of the spinous processes. That's called the supraspinous ligament. Interspinous ligament, supraspinous ligament. Right? We can also see this. There's the thecal sac, right, or the dural sac. We can see, it looks like the spinal cord, that's probably the conus medullaris, that's the tip of the spinal cord right here. and it's encased by this sac called the dural sac or the thecal sac. And then we have a branching nerve here. So you can see the dorsal root ganglia is that little white bump right there. And then this would be the spinal nerve. Which spinal nerve? Well, if that's 1, that's L2. It's coming out of the L2 foramen, so that's the L2 spinal nerve. Everybody good with that? All right. This is another important one. This one is quite busy. Again, we'll go over in class this thing in a little while. Oh, this is a big one, isn't it? All right, so there it is. So this is a cut. It's an axial cut through the intervertebral disc. And there's our nucleus pulses in gray here. You can see it surrounded by the annulus fibrosus. What makes up the annulus fibrosus? You can see there's usually about 20 of these, but I made them bigger. So those are the lamellae of the annulus fibrosus. The disc, kind of, if you remember one thing today, remember the disc has pain nerve fiber in it. Specifically, it has, what are pain nerve fibers called? Those are called Nosial Scepters. So these little yellow things are Nosial Scepters, and they're more functional in the back and in these posterolateral corners. Over here on the side, they don't function as well. Those are more sympathetically derived, and they don't transmit pain. See if I move it up here. These are pure sympathetic, and they don't, it's thought not to really transmit the sensation of pain, current thinking. Let's go back to this important part, because most disc herniations occur right here. You get a rip through the disc, and this nucleus pulses gets out here and irritates, causes an inflammation, and you get horrible discogenic low back pain. So let's look at how these things work. So the little lollipops here, those are the Nosial Scepters. If they get irritated from a tear, an annular tear, they transmit the signal of pain. But where does that signal of pain go? It goes down this, I guess it's an orange nerve right here. Let me blow up. See if we can get a better look at that. Okay, see all the lollipops connected to this orange thing. I guess I should have made this pink thing. That's the posterior longitudinal ligament. Where is it? I can see it over here better. See the pink thing? That's the posterior longitudinal ligament. I should have made that blue so these stand out. But that orange thing, that is called the sinuvertebral nerve, aka recurrent meningeal nerve. That's really super clinically important because that transmits the signal of discogenic pain. What's the number one cause of chronic back pain? And I mean chronic, it's been around for 6 months or so. Not a sprain, strain of the muscle or the ligament. Something that is chronic. Sprain, strain of the muscle and ligament is not going to be a chronic condition. That's going to get better. Unless, of course, they keep re-injuring it over and over again. So an annular tear is the number one cause of low back pain. How is that signal of pain transmitted? Down these little lollipops, down the sinuvertebral nerve, which, let's see the path of this thing now. Let's blow back up a little bit. So here's the path. It takes the signal of pain out. It goes out of the neural foramen. This is the neural foramen right here. Out of the neural foramen, and it dives back in the anterior ramus here. And I don't have to go over this again, do I? Remember, these are the two spinal nerve roots. So this is the sensory root. This is the motor root. And there's the dorsal root ganglia. That's how I can tell that's the sensory root. They come together to form the spinal nerve, which is right there. Spinal nerve splits into two portions. This is the posterior ramus. This is the anterior ramus, aka dorsal ramus, aka ventral ramus. So the signal of pain travels down the sinuvertebral nerve and it dumps in to the ventral ramus. And inside here, it turns right around and the fibers go down the sensory root here. They have a cell body here like everybody else, and then they go up to the sensory cortex of the brain. So the AKA recurrent meningeal nerve is because the signal goes out of the IVF, dumps into the ventral ramus, and it comes back into the IVF. So recurrent meningeal nerve. Okay? Other clinically, and what's the number 2 cause of chronic back pain? This guy right here. So that's the facet joint. See the lollipops in here? Those are Nosial Scepters of the medial branch of the dorsal ramus. So I do like that because that's what your patients with facet joint pain, which is probably our number 1 thing that chiropractors treat, is facet problems. Where does the pain come from? It comes from the medial branch of the posterior ramus. I expect you to know that like your ABCs. Right? There's a lateral branch here we won't talk about. We'll talk about in class. There's an intermediate branch that comes out sometimes. The other thing to know about this medial branch, it does go up and supply the multifidi muscle, just a little segment, a little tiny segment of it right above. Multifidi is a very important, clinically important muscle, and that's all I'll say about it right now. All right, what else can we look at? Okay, let's take a look at these lollipops again. Okay, so there's the Nosial Scepters of the sinuvertebral nerve. They're really tiny. I don't know if you can see them or not. I have these pictures if you're in live in, or I guess you guys aren't live in lab, but I have big blow-up pictures that you can look at. But they do connect to the posterior longitudinal ligament, and they connect to this thing. What is this thing? That's the thecal sac, right? Or the dural sac. So the front of the dural sac is also innervated by the sinuvertebral nerves as well. Right? If this is L4, let's call this the L4 disc. What are these? Those are the L5 traversing roots. They haven't come off the thecal sac yet. What are these? Well, those are if this is L4, these are the L4 exiting roots here, right? Sensory motor, that's the L4 spinal nerve. They've already budded off the thecal sac up higher at the level above, right? I think we've talked about that. What else can I say? I think we're just about done. This thing, lumbar spine, that's the gray ramus communicans. Right, that carries sympathetic nerve fiber. Sympathetic nerve fiber. Some of the sympathetic fiber actually mixes into the sinuvertebral nerve and can come back. We're not exactly sure what it's for. Some people think it might be proprioceptive function. But most of the sympathetic fiber dumps into the ventral ramus and it mixes with the other nerve. Spinal nerve, right, this is a mixed nerve here. This is one of your targets for gross anatomy. That is the lumbar sympathetic ganglia, right? The lumbar sympathetic chain is kind of marked by 3 or 4 bumps, which are ganglia. So that's a lumbar sympathetic ganglia. And this is pure sympathetic fiber here. That's just a sympathetic sensory root, and that supplies the anterior portion of the disc. All right, I think I got everything. Let's see, that I can remember. How about this black area? Let's blow that up a little. What about the black area inside the thecal sac? Well, you could call that the subdural space, or subarachnoid space, right? Not subdural, subarachnoid space. Or you could call it the intrathecal space. How about this area out here? All this black. And normally there would be fat. Ligamentum flavum's not on this cartoon, but this is the epidural space. This is where epidural steroid injections hit this space here. If you're having a baby and you need a caudal, you have so much pain, you want to block the sensation, the lower extremities, you do an interthecal block. But a epidural, which is for the treatment of sciatica, That's an epidural space. Some people call it extrathecal space, but where's the pia mater? Where's the pia mater? Is that it? No, that's the dura mater. With the arachnoid, you can't see the arachnoid is stuck to the bottom. The pia mater is yellow. It's surrounding each one of these roots of the quad equina. You could call these traversing roots if you want as well. All right, that is definitely long enough.